Is there a hashtag for Catalyst 2030?
Hashtag for the conference week is hashtag Catalyzing Change Week.
Okay. Got it.
Catalyst 2030 started life as a WhatsApp group among social entrepreneurs, connecting to envision real transformational change. Launched at the World Economic Forum in January 2020, it's grown into a global movement accelerating change to ensure the SDGs are reached by 2030. Fueled by passion, our 550 members working in 175 countries have collectively put in an amazing 50,000 volunteer hours, touching the lives of 2 billion people. And we're driven by values, to which we hold ourselves accountable. 2020 was a busy year, co-creating 3 reports with partners and producing one of our own. Inviting high-level guests to participate in the Catalyzing Change campaign, hosting fireside chats and expert hours, which will be continuing in 2021. To celebrate our achievements, together we placed our supporters in the limelight with the first Catalyst 2030 Awards for Systemic Change. With the blessing of the Dalai Lama, we celebrated finalists and winners in the following categories: special recognition for our early supporters, individual philanthropists, donor organizations, philanthropic intermediaries, corporate organizations, bi- and multilateral organizations, and 4 regional winners in the category of national governments. And now on to Catalyzing Change Week 2021. During this social entrepreneur-led event, we bring together diverse stakeholders in over 100 sessions to showcase their systems change efforts and the best practices that can accelerate our work in pursuit of the SDGs.
Everyone, so I'm going to pass over to Jean from Accountability Lab. Thanks very much for being here.
Hi, everyone. Lovely to see you all today, and really looking forward to our conversation. I just want to quickly share my screen. So my name is Jean, and I am the Director for Growth and Strategy at the Accountability Lab, an organization working across 9 different countries to make governance work for people by supporting active citizens, responsible leaders, and accountable institutions. In March of 2020, the Accountability Lab, like many of you listening today, made plans to just get ourselves through the pandemic. We took activities online, we set up health and safety protocols for our teammates who live in some of the most vulnerable places in the world, and we dreamed about the day that things would just go back to normal. What we quickly realized, though, was that the initial 2-week stay-at-home order was not going to be enough, and normal would remain an elusive concept for a very long time. While the human suffering and loss brought on by COVID will affect us for generations to come, the pandemic has also provided what Archbishop Desmond Tutu calls a dangerous opportunity to reshape our sector to be more adaptable, inclusive, accountable, and equitable. While the lab has identified 5 key traits of a sustainable post-COVID CSO, and you can find them here, we are not the only ones. And today we're going to be speaking to 3 women who I think are doing a brilliant job embedding these adaptations to improve the way we do things in the post-COVID world. Nadia Nabawala is a senior advisor to the Citizens Foundation, an education-focused organization based in Pakistan. Rehema Namkose, founder of Reignite Africa, a youth and women's focused organization based in Uganda, and Leisha McCormick, CEO of Last Mile Health, working across a number of countries in Africa to improve public health outcomes. And we're really looking forward to having a little bit more of a conversation about sort of what they believe an effective post-pandemic CSO should look like. And so firstly, I'd like to ask Nadia to talk a little bit about what adaptations TCF has made since the start of COVID and how things have changed.
Thank you, Jean. So a lot changed, and a lot changed rapidly after the lockdowns happened in Pakistan in March. Our board met within days and made some decisions about what would happen next. And broadly, these were 3 things, but what they did is they leveraged the strengths that we've developed over 25 years as a local organization. TCF is a school system for out-of-school children in Pakistan. The Economist has called us one of the largest school systems in the world. We have 1,600 schools across the country, and we're the largest private employer of women in the country. So even though we're a school system, the first things that we deployed to do was to help the survival needs of both our faculty and families in the communities where we work, not necessarily our students. And then second, to focus not on the academic, but the social emotional needs of our students and faculty. Because of being a local organization, we were also able to rapidly establish partnerships of diverse kinds with the government, with private companies, and with other nonprofits. And what this ended up looking like was first delivering large-scale national relief in communities that were otherwise not reached. So we shortlisted among our 700 communities, about the 150 that were the worst off based on socioeconomic data that we had, and then leveraged our alumni and faculty in those communities to identify those who were most in need. And because of the lockdowns, you couldn't travel. So it was having alumni who have now, are now 20 to 22 kind of university coming back to their communities. They were the ones who did surveys and identified households that needed help. We partnered with Jazz, which is the largest telecom in the country, to distribute cash transfers. And there were moments where a lot of these communities, for example, people don't have telephones. So our alumni worked with Jazz to establish that this person is the person identified, their ID card matches, they don't have a phone, but can we hand over the cash transfer that we owe to this family? Secondly, there was a duty of care to the people who work for us. So like I mentioned, we're the largest. We hire only women as faculty in our schools so that parents send girls to school. So we have 12,500 principals and teachers who are all women. And we decided that nobody is going to lose their jobs. Quite the contrary, we will retain everyone. And even, we were delivering salaries at women's doorsteps when the first of the month came around. And this was really important because in a lot of our families, the man had lost his job as a daily wage worker or, had been let go. And these are really tiny villages. So the families were dependent on the salary of the woman. Thirdly, a lot changed in terms of distance learning. Our students are not online. They don't have devices. These are communities where kids were out of school until we built schools there. And we partnered with the government, and the government rolled out a teleschool channel on public television, which is very academically focused in its objectives. And we took a very different approach, and we did dedicated production filmed from home of a television show that did 3 things. First, it focused on social emotional health of kids, recognizing that they needed some outlets and they needed to, laugh and enjoy in order to be engaged, to learn from television. So we were reading storybooks on TV. Celebrities were actually reading storybooks that we've written. There was physical exercise, which I thought was quite phenomenal on state television, because you had a girl wearing pants and a shirt, like jumping around, which is a bit challenging for state television in Pakistan for the government to sign on to. And then we focused on early grade skills, literacy, numeracy, and cognitive skills, which most children lack. And we did this in a multi-grade mindset, meaning that children of multiple ages should be able to watch at one time, which was different from the government's approach of, of asking kids to wake up and tune in for 30-minute segments to see their grade levels television channel. So there were a lot of changes that happened. And as the situation shifts, we're continuing to shift the way that we educate. And the outcome of all of these things was staying connected with communities through Relief, through actually also not just the television show, but a magazine that we published to reach kids who didn't even have televisions, was that when schools did reopen, we are now at the highest capacity kind of utilization of our schools ever. If we're normally at 85%, we're currently at 94%. So the retention rates are really high. There's a ton of demand for our schools because a lot of families can't pay private school fees anymore. In Pakistan, 40% of kids go to low-cost private schools. A lot of those schools are closing down because people can't pay anymore. And we're actually opening new afternoon shifts in our school buildings to accommodate the demand. A lot of government schools are crowded, so parents are also sending their kids to our schools. So yeah, and I mean, there continues to be a lot of change based on our kind of assessment of what's happening to the people around us.
Yeah, wow, that's amazing. And I think there's definitely something to be said, and I think we'll discuss a little bit later, but I think also the ability to be a little bit more flexible. So around like the finances, the traditionally money requires invoices and receipts and 50 different forms of signature and being able to say an emergency is happening, what's the worst can happen? We need people to get fed and be able to look after themselves. And I think it's definitely one of the big learnings, I think, is flexibility around money. Rehema. So Rehema is based in Uganda, and she runs an amazing organization called Reignite Africa, mostly working with women and girls and young people. And they've also made a number of sort of changes to the way that they work and the things that they do around COVID. Rehema has asked me to let you guys know that her internet is a little bit unstable, but she's going to try and chat, and she maybe won't be on video. Rehema.
I think Rehema might have dropped off, unfortunately.
Okay, if she jumps back in, we'll go straight to her. But in the meantime, Leisha is the CEO of Last Mile Health. What sort of changes do you guys make around COVID?
Yeah, thanks so much, Jean. And if we see Rehema jump back on the line, please feel free to interrupt me midstream. I definitely want to make sure that she has a chance to add to this conversation. So it's really good to be with you, and Jean and Catalyst 2030, really happy to have you host this conversation. When I think about the question, what's changed, I think my initial reaction is that the pandemic has exposed many inequities that have long been present, but that haven't received the attention that they deserve. And at Last Mile Health, we've long known that the health of any one of us is connected to the health and well-being of all of us. And I think COVID for all of us has really underscored this truth. So over the past year, I think many of us, and I'm seeing a really wonderful community assembling on this call, have been navigating a global health crisis. And at Last Mile Health, an organization that exists to participate and to support global public health, we've been doing an enormous amount of work related to protecting and promoting the health workforce that we need to combat this pandemic. And that's been challenging. It's been very difficult in a number of moments. I think there's been a lot of great fear and uncertainty, and there's really been a need to rapidly adapt to changing circumstances. Our team has worked pretty tirelessly over the past year, as I referenced, to equip health workers on the front lines of pandemic with personal protective equipment and with up-to-date information and technology. And this has been a time that's really in many ways been galvanizing, because one thing we saw during this pandemic was that the levels of care provided by community health workers in Liberia did not change, despite the fact that COVID was present. And this was not entirely unexpected. I think following the 2014-2015 Ebola epidemic, the government of Liberia committed to building a national community health worker program, which Last Mile Health supported. And the idea that strong primary care teams that include professionalized community health workers and that can provide primary care people need and respond effectively to a crisis is something that we've seen be borne out time and time again. COVID-19 has definitely put this to the test, and here's what we've seen. Early data indicates that primary care provided by community health workers has already held steady since the onset of the pandemic, with only marginal decreases in facility-based delivery rates. And what we see that as meaning for civil society organizations like Last Mile Health is the experience has underscored the power of partnership with community to make sure that you can build enduring solutions that can be adapted in moments of crisis. And I think Liberia's path to serving patients that had previously been out of reach has definitely been a long journey, but it's yielded powerful results in this moment that has mean that the adaptation has actually been more omnipresent than the need to rapidly deploy new or wholly standalone solutions.
Yeah, no, I mean, I think that's something that we also learned at the lab is, I think working through established channels, working through things that have already worked as opposed to just reestablishing new things, I think is always more effective and gets things done much more effectively. And so let's just check, is Rehema back? I don't think so, not yet. One of the main things Rehema was talking about was sort of how, when we discussed a little bit earlier, she was talking about how it really has, COVID's been really negatively affected, particularly young people and particularly young women within Uganda. And I think the socio-political, particularly the political situation in Uganda has also exacerbated a lot of the challenges. But she was going to share some really good examples of how young people have overcome and again, used sort of existing networks to sort of get information out there, dispel like sort of untruths or mistruths around COVID, and even though they're not seen as sort of maybe the most sort of effective in terms of like numbers, but they've been really effective in terms of local interventions really getting good results on a local level, and I think many of us have found that in other places too. So one of the other questions I wanted to ask is, now that, I think we're not coming to the end of COVID, I think it's going to continue for a while, but I think that, as we're starting to sort of see the results of the last year, what sort of organizational and programmatic changes that, you guys made at TCF and Last Mile Health, do you think will remain beyond the end of the pandemic? Nadia?
I think so there are things that we started to do that will continue, especially the magazine that we started publishing, recognizing that most kids don't have reading materials in their own languages at home, that they go home after school, they don't have support at home. So this is kind of having something that is edutainment, but accessible, extremely low cost, and allows them to self-learn and do DIY activities and have stories and puzzles, was something I don't think we thought of before, that we were forced to think of, and then are continuing to publish. But the other big thing is a focus on social emotional health. of our students. So with schools reopening, the curriculum has changed in all of our schools. And that's a change that was actually, it's here to stay also because it's something that we thought we needed to do and a shift that we were gradually making alongside, say, play-based education, more nutrition, and more kind of theme-based learning, a lot of 21st century skills types of things, but the social emotional component has been accelerated. So now in TCF schools, at the beginning of every day and at the end of every day, children have reflection where they're able to learn to kind of talk about what they're feeling, learn to, have a vocabulary for their feelings. And this is, I think, especially important for boys for whom it can be very acceptable to be angry. And they don't have a vocabulary to understand that their anger may be that they're embarrassed, and, maybe that they're scared. It may be that they're holding on to some guilt. So that social emotional focus, I think, has stayed, and there are other shifts that have happened in terms of, I think, putting the stress, like really being mindful of the stress that's being created for faculty. So we know that, there hasn't been testing, but to be able to say that, the government does testing in some of our schools, especially the government schools that we manage, and to say that, our kids are not going to do as well this year, and we're okay with that, because it's too much stress to be trying to cover the entire curriculum in, say, a third of the year. And to look at the curriculum and say, there's a lot of redundant content in this curriculum. You don't need to learn about the same national hero in 5 different subjects, and sometimes the same exact content, but just in multiple languages that kids don't understand anyways. And to say, we're going to take that out and focus on the skills that need to be learned and built upon year after year. So it's, I think, forced decision-making that needs to actually, kind of strategic thinking about content in education, that needs to happen on a national level. And I think my only wish and hope is still that, I think, and this is the difference perhaps, that I would wish that the government and even other organizations really, really question in a hard way what is demand-driven that they do, which is how we're, say, shaping what we do, rather than what's supply driven. And what I see a lot with what the government is doing, and I say this in my own personal capacity, but also what a lot of other organizations can do for their own incentives and reasons, is a lot of supply driven response, which isn't true response. And that's probably an ethic that kind of permeates during emergency and post-emergency, and leads to kind of organizations being stronger if they can do it.
A quick follow-up on that. How are you guys being sort of fundraising for these new changes? Because, fine, you can fundraise for it right now during COVID, and you're saying, oh, everyone's at home and this is why. But if you're really seeing that the magazines are working and that the TV shows are working, and the social emotional health stuff is working, how are you managing to sort of shift your sort of donor priorities to be able to say, actually, guys, this works, you need to be funding this, and getting back to that demand side versus supply?
So I think this kind of raises a question of what it means to be a local organization. And for us, we basically, TCF, I mean, I'm American, but I'm probably the only American at TCF. And we've been around for 25 years. We sustain on local giving. So we receive a lot of local donations, local as well as diaspora donations. A lot of the giving is unrestricted. So we've grown because of this, our budget, which is largely unrestricted. So people give to us because they trust the organization. And then the initiatives that we do, like the magazine, are very low cost. The television show didn't cost much to film because it was filmed from home. A lot of people donate their time. If we have celebrities on TV reading content, or content that we use in the magazine, for example, a lot of it is donated by like-minded organizations. And I think it's also interesting to realize that while we think of this dichotomy between developed and developing and poor and rich countries, that there's a lot of wealth within nations, that it's unevenly distributed within, say, poor countries. And so there's a lot that's happening there in terms of people helping their neighbor, and then even institutionalizing the ways in which they help their own country and communities. so that's what's, I think, allowed us to have that flexibility. And we also raise a lot of money during Ramadan. So zakat, which Muslims are required to give 1 or 2% of their wealth, that happened in May, and the lockdowns happened in March. So actually, by delivering relief and using 20% of all donations that were given to us for immediate cash transfers to the people in the highest need, that actually kept people giving to TCF. And so it was both a strategy that kind of met the immediate need because families were calling us, and it was something that was a duty of care to our communities, but that also, helped that time of year when 60% of our donations come in, to kind of stay on track.
Amazing. Lisha, same question to you. What are the sort of organizational or programmatic changes do you think will remain beyond the pandemic?
Yeah, I really appreciate that. I think I will take the liberty just very quickly to riff on a little bit of what Nadia just shared, because I think that there's so much that I've long admired about Nadia, and also the citizen schools. In a moment of crisis, I think that philanthropy can generally play one of two roles. I think it can play a role in which it is further fragmenting and disrupting areas around rapid response. And Nadia, I love the point that you made around demand-driven activities and demand-driven interventions. And I think especially in this day and age when we're hearing so many people talk about decolonization of aid, the notion that there should be local agency and articulation of the things that are actually needed, especially in moments of crisis, I think are so poignantly true. And when done well, I think that the work of civil society organizations and of philanthropic giving, especially in moments of crisis, can actually be one in which it better enables adaptation, in which it better enables speed in response, in which it better enables collaboration, and groups being able to sort of step forward and say that they have core capabilities or competencies. Or I think a lot of what we're hearing from Nadia and Rehema, if she were on the line, is that there is a deep level of trust and an established platform that folks are willing to lean into and to trust in moments of crisis. And I think that that cannot be underscored. I had a call earlier today with a colleague that I admire so deeply that I think our loved ones and peers in India are very top of mind right now. And thinking about how organizations that are working on things like education or water and sanitation can actually use the community affiliations that they have to make modifications to be able to deploy activities or actions that are going to be vital to helping to protect against loss of life around the COVID pandemic, I think has been huge. So that was sort of just a little bit of a recognition. I think so much of what Nadia just shared is very apropos. And then I think for last mile health specifically, I think that the COVID response really highlighted the need to take an integrated approach when designing interventions, when deploying philanthropic capital. And I think as we work to address the COVID-19 crisis, the question is, how do we leverage this as an opportunity to build health systems that endure? We saw this during the HIV/AIDS crisis of the 1990s. We saw this with Ebola in West Africa in 2014 and 2015, that there was an ability to stand up a strong continuum of care related to primary health that was able to then sustain and be durable when those particular acute crises sort of died down, and when we were actually left with sort of the everyday crises of preventable illness, particularly in women and children. I think the question before us is how to take this urgent global need. And, I think from where I'm perched, that is that millions of health workers are going to be needed to vaccinate a global population and turn it into an opportunity to achieve care for all. So, I think that that's something that we're really committed to, that we're really working towards. And I would hope that emerging from COVID, we can see that funders, governments, civil society are able to stay focused on integrated approaches that actually really leverage existing networks and communities and platforms of trust that have actually been long established and that frequently are led by local heroes.
Thank you, Lisha. And I think that also leads really well to one of our first questions, which was talk a little bit more between the two of you with these sort of organizations that you guys work in, on the trust and credibility that you've gained from previous crises, that you're now able to leverage those sort of relationships and the trust and the sort of solutions to this one. Alicia, you mentioned a little bit about Ebola, but I think, this takes time. Just going into communities is not helpful. It really is about, the long time, the sort of being there every day, even when things are great and when they're not so great.
Yeah. Nadia, do you want me to speak to that first, or would you prefer to do so?
Go ahead.
Yeah, I mean, it's interesting, Jean, because I think it's something where for those of us, and there are many of you on this call that do this work is really hard. And the notion of being able to establish credibility, sometimes it just means continuing to show up, like day in and day out. And when things get difficult, to continue to be there and to continue to show up and to listen. I think that for us, there were a number of times where, we perhaps have a very specific mission orientation and a very specific remit. But when you're in a context, I think particularly during crisis, when partners or collaborators are looking to you and saying that there are specific things that they need, being able to swim a little bit outside your lane, or being able to adapt what you're able to work on or work towards, I think is something that we've seen has been absolutely vital. I think it's taught us a lot, and I think it's paid dividends in terms of being like an earnest partnership, right? Of one in which it's a bit of give and take, it's a bit of listen, it's a bit of sort of indicating what you can and what you can't do. And I think over time, that is something where it demonstrates like real earnestness of intent. It shows what individual organizations' values are all about. And fundamentally, it means that we're actually there to help solve a problem, not to independently preserve one solitary institution.
Mm-hmm. Yeah.
Yeah, I think it is the day in and day out. That's kind of where you build your strengths, that give you something to leverage when you need to change, in order to continue to serve your mission. So yeah, in previous crises that have happened in Pakistan has had major earthquakes, especially one in particular in 2005, and flooding as well. And we have done relief in the past. We have shown up and built schools where they were destroyed. But we've also been an incredibly focused organization for 25 years. When people come to us and say, why don't you do this XYZ project? And with 18,000 donors who are largely individuals who each have sponsored one of our kind of 1,600 or 1,300 schools, which are the ones that are purpose-built, there's a lot of noise. And so I think for 25 years, there was a very deliberate decision to focus, and to not get out of our lane. And I think for a lot of organizations today, there's something to be said for shutting out the noise and actually looking to the ground and doing what needs to be done there. And not just in this world, like I've seen it in development as well in Pakistan, where even a lot of donors admire those organizations or governments that do what needs to be done and say no to them, actually. Have that, I guess, integrity to say no, because that's the level of commitment that they have to their own mission, and what they know of the people that they serve. So I think that that's what we, after 25 years, especially with this pandemic response, we had to make a deliberate decision then. And we had started to make that decision about probably 2 years ago or so, which was to change what we do, to open up to new models, to go there. And, it's not easy working with the government. It's not easy establishing those partnerships at all. But to finally say we have the bandwidth that even if this is a time sink, we're going to try it. And we're going to, if we need to be there for 10 years to influence a policy, we're going to be there. And so when they invited us during COVID, we were there, and we reached out to a telecom, and so it came after we built a lot of organizational strength and then could make very deliberate decisions about, the extent to which we were focused and the extent to which we were not, and we were going to change and embrace change.
Brilliant. No, and we have Rehema back. So we're just going to Rehema. We're very excited to hear some of your points. I think that we've been having a bit of a discussion about sort of some of the main adaptations that you guys have made as a result of COVID, and then we moved sort of towards question 2, which are sort of what are those changes, which of those changes, whether they be programmatic or organizational, do you think will remain post the end or after the end of the pandemic?
Sure. Thank you so much, Jean. And I'm very happy to finally try and say something. My name is Rehema Namkose, and I'm a youth and women's rights advocate, currently based in Uganda. I work with Reignite Africa, social enterprise tackling unemployment and issues related to livelihood and labor rights among young adults. Uganda has one of the highest levels of unemployment in the world. It also has one of the youngest populations. And young people, especially young women, have been, affected by this social issue. And when COVID hit, things were escalated on many levels. And one of the ways we've been trying to adapt our programming for specifically our programs that focus on school to work transition and those that directly work with youth groups that are particularly vulnerable, out of school youth in the formal and informal sector, is that we've tried to pivot and adapt quickly to the new ways of working. So one of them has been moving our programming to online implementation. This means that we've generally integrated the use of digital media into how we do outreaches to young people for our career and professional development programs. We've had to adapt our youth voices. This is our advocacy arm of our work. And here we've had to engage young people, particularly young advocates and artists, to engage them in conversations that are shaping the narratives around how the response in recovery, rebuilding, and generally tackling the current pandemic, but also the issues that have been that have risen out of the pandemic. So we've had to adapt quickly to that. Another thing that I could speak about is that because COVID has affected social interaction, and I'm not sure someone might have shared about this, but because COVID interrupted social interaction, disrupted how young people are used to connecting with one another, particularly in this part of the world, we've had to think about ways to support young people who are seeking support in terms of, feeling alone and not connected to their, peers. The toll on young people's mental health generally in sub-Saharan Africa, not just here in Uganda, has really been underestimated. And I know current funding has mostly shifted to the COVID response with undoubtable results in the gaps. I feel like the pandemic has especially accelerated the impact of mental health challenges to young people's young people's well-being and general. I would say just general well-being. So I think I'll stop there for now because I'm not sure these more points I could share, but I'm trying to be cognizant of the time.
Thank you, Rehema. No, that's brilliant. And I think just to tack on to what you were saying, sort of what are the sorts of things do you think will stay that you guys have been doing with Reignite that will stay beyond the pandemic? So hopefully people can start to work together again and see each other. But are there any real successes that you've seen taking things online and adaptations that you've made during COVID that will that will stay?
Yes, I feel like, I mean, some of these things that were already existing, we've had through sub-research we collaborated on with partners at ODI. We found that there were new models of collaboration between youth, international NGOs, and other private partners. And these partnerships have come in the form of using online media platforms to engage, connect, keep work going. Social media gives young people the power to raise awareness about, their community priorities as new reporters on issues that affect them and their community. So that new way of working and embracing the use of digital media to actually reach young people, I feel like it's something that has really stood out during this time, and I would really advocate for it to stay and to be built further. Another thing is that there's been a heightened COVID-19, the pandemic has really highlighted the digital divide between young people who have access to digital media and those who don't. We feel like young people, for us to do service provision as a social enterprise and an organization that does a bit of advocacy, we've seen that young people who have access to digital media have had access to many opportunities compared to those who do not have. And as service providers, as community organizations, we've been challenged to think about how do we make sure that this digital divide doesn't stay beyond COVID-19. So I feel like the pandemic has shone light on this challenge, but it's also given us an opportunity to reflect on it.
Brilliant, thank you, Rehema. I wanted to ask Nadeem Hussain's question, and around, which is mostly a question to Nadia, but I think very similar, I think it's relevant for both Lisha and Rehema's interventions, is around the digital divide. Marginalized children are not really able to attend online classes as easily as their privileged peers. How do you see this impacting kids in the long run? Sort of when it comes down to university and future employment.
You want me to respond or Nadeem to respond?
I mean, I think if you want to make a first stab at it, and then Nadeem, would be lovely if you
I would let Nadeem respond because he's one of our alumni and he works with a lot of our students who are in university. So Nadeem, and he's actually worked with the governments on reforms as well. So he knows a lot more about this than I do.
Brilliant. Nadeem?
Yeah, thank you, Nadia. I think the question was primarily for you, and I just wanted to hear your thoughts on this. But thank you for asking me to share my thoughts. I think this would put kids from the rural areas and from the underprivileged backgrounds on a very disadvantaged future possibilities within the country. I mean, this, in my opinion, this would widen the socioeconomic gap for at least for the next 1 decade or so. But I would love to hear your thoughts on this as well.
Well, one thing that I realized during the course of this was that there's been a lot of focus on primary education, especially amongst donors and even think tanks. So something interesting is how the research agendas of think tanks are determined sometimes by donors as well. And if the emphasis is on primary education or on certain segments, then you don't hear about the others. And so tertiary education has really been impacted. So I know with students that, schools might close down, but universities, a lot of them insist, especially high-end universities, insisted on going online and then would penalize our students for not having devices, not being able to show up for testing. So there's a lot there. And there was a lot of need for devices, for example, for our students, and things that didn't align with, say, what donors wanted to give or where their interest areas were. So there was definitely, I think, there's a lot going on in this space. There were a lot of protests in Pakistan amongst students. There are places where the military is denying bandwidth because they don't want people to be connected in conflict areas where students are, it will change a generation. So I think the issue of tertiary education and university needs more attention.
And I think this is very much, I think, a universal challenge, because there's both the great things that the proximity divide has been closed because of sort of the internet and connectivity, and now meetings that are generally closed for people who can only travel in and get the right visas and passports is one thing. But now but there's also that part of there's so many more people who are not completely excluded because they can't engage. So Sherry asked a question about the ways in which the three of you have learned from failure. So have there been any things that just you tried and just really didn't work and didn't give you the results that you envisioned? And how have you sort of managed to sort of course correct? Because often failure is so much less acceptable when you're in a crisis.
Alicia, do you want to go first, or do you want me to go first?
Sure, I can chime in and I'll aim to be brief. Thanks, Shirley, for the question. I would say for us in moments of crisis, I think the trap that we've fallen into is sometimes trying to do too much. And, I think that when you're operating in an environment in which the need is so acute and it truly is life or death, we found ourselves stretched quite thin, and ultimately had to take a step back and ask ourselves, what are the core capabilities or the things that we're really good at? And for us at Last Mile Health, we're really good at working with community and government. We're really good at health worker training. We're really good at working in remote and rural areas. So how do we do more, but how do we do more in those spaces? And I think that allowed us to sort of extend ourselves to be of service, but it also allowed us to learn from areas of failure in which we had been spread far too thin, and ultimately were not as effective as we needed to be in any of the multitudes of things that we were taking on.
That's really good advice. Really good advice. Rehema, are you there? Have there been any things that you've learned or failed?
I mean, the past year has one of the biggest lessons we learned, especially at the beginning of the pandemic, was to stop, pause, and trying to figure out. There was a lot of chaos, as leaders, even as people serving in communities, you're bound to just do as everyone is doing, try to do something, when really sometimes the best thing to do is first stop, pause, and think about how best to approach a situation. And being young, a younger generation of leaders that I work and collaborate with, one of the challenges we had was we were trying to figure out how to best go about it, how to work with youth groups and respond to their needs. And in the moment, we felt ill-equipped, we didn't have the resources, but it was important for us to stop and think about what really mattered in the moment and learn from that, despite the pressure to act and move. I think that was an important lesson for us to learn. And from it, we realized that we needed to first consult with, our key constituents, and those were the young people that we work with. And from there, we actually started getting the best course of action, and it informed our way forward.
So I think there's going to be a lot of failure in terms of the learning outcomes through this period. And that's because, well, we were taking on new things. So one, there are going to be operational challenges, even though we pride ourselves in implementation. There are a lot of operational challenges to work through, but also with things like edutainment, magazine, and television, those are specialized areas where, like Sesame Street spent years and billions of dollars in the 1950s figuring out how to entertain and educate kids simultaneously. So I think to just look at our interventions, which is, I think, the mistake that I make and that a lot of people make, and say like, wow, we have fixed this problem, is just horribly flawed and kind of, what do you call it? It's just kind of like a bit delusions, like of grandeur and self-grandeur, just a bit diluted. And I think there is a need to always, I think, keep it real and focus on, how you are seen from the receiving end, and how much, your impact actually is after you've done these things. And with TCF, I mean, TCF has built a lot of systems to measure the efficacy of what it does in various ways. I mean, they've built the most complex matrices to define an effective school leader, and now what's an effective teacher, and then they do these measurements year after year. But the end game of that is to say that, we put ourselves at maybe a 7, maybe a 6.5. I mean, if you ask our leadership, these are the things they will tell you. They're not the most horribly impressed with themselves. And it's that constant sense, that focus on that 3.5 that they're not getting right, which keeps the organization kind of really chasing that, how do we make it better? How do we make it better? How do we make it better? And if you keep your standards, internally, really high, if you want your schools to be as good as the best schools that the privileged have around the world, your school monitoring system should be as as good as they are in the UK, your curriculum should be as good as it is in Canada or the United States, then there's nowhere else to be, I think, sometimes except for failure, because you're always measuring yourself up against the best. So yeah, I think having a real sense of failure and then the humility associated with that failure is something very strange at TCF. And sometimes we've debated whether it's a serious problem or not, because therefore we don't put ourselves out there in a huge way, except for me, who gets put on panels. But yeah, but it is why the organization, I think, has achieved what it has through these qualities in this culture.
That's no, I think that's really good advice, and a really good response on that one. So we have a few minutes left, and we had one question on duty of care, but the other thing I thought we could do for the last 5 minutes is I've sort of put into a small slide just some of the things that have mostly been mentioned now, around sort of what we really can do and what should we be asking others to do post-COVID, in particular around sort of, I think, financing and sort of just making sure that some of the things that we've learned and the adaptations that we've made really can be embedded and go forward. And so I think some of the main things that came out were we must show up. We've got to listen when people tell you what they need. And I think that sort of came with some of the TCF and the small funding, about being agile and willing to swim outside your lane, lean into pathways that work and use those to improve outcomes, stop, pause and think. Are there any other things that you guys would add that you would really sort of share with donors or partners or friends, from things that you've learned over the last year that you would like people to know and remember for the next crisis, or even just, hopefully when the world goes back to normal? Rehema, if you're with us, do you want to jump in there? I think you're on mute. Lisha, do you want to jump in, and then I'll see if I can get Rehema back?
Sure thing. I'd say if the question is, where should civil society be focused after the pandemic? No matter how you answer this question, equity needs to be at the top of the agenda. And for us at Last Mile Health, that means continuing to advocate for healthcare as a human right. We believe that high quality care should be available to all, regardless of income. And I would further say, the COVID-19 pandemic has also underscored that equity means designing programs and solutions that are also gender responsive rather than gender neutral. And I think you've heard Rehema and Nadia speak to this in a really thoughtful way. We know from a health workforce perspective that 70% of frontline health workers are women. This means that they have been disproportionately impacted by the pandemic. And in addition to advocating for all community health and frontline health workers to be adequately paid and protected, so speaking to Blair's good question around duty of care, we also need to make sure that folks are paid, that they have the PPE that they need, and that gender mainstreaming is actually integrated into programming in a real and intentional way. And I would say that going forward, we need to be relentless in our pursuit of proximity. The work of civil society should be informed directly by local needs. I hope that's helpful, Jean.
I think those are really good. They're really great. Nadia.
There were some great points that I remember Leisha made in our preparation for this panel. And one is, it's something that I think everyone experienced, and I'm going to speak a bit to donors here, but that after the pandemic and the lockdowns, a lot of donors started kind of giving to those who they knew. And we experienced this as well, which is the people that we knew were very generous with us. And when it comes to kind of the foundations, et cetera, but it's been impossible to establish, any really new relationships. And I know a lot of people have experienced this. And I think that speaks in general to this difficulty of, the risk and how do you know who to trust? And I think we need to develop new ways and change the way we determine who we trust. And I used to be a donor with USIP. It was an organization that I moved to Pakistan with, where we gave grants. And this was a really big thing for me. And I wanted to mimic more of the local ecosystem. And I think we need to look at who do locals trust? Where is local giving going? How do they approach change in their own communities? And I think those are the most powerful indicators of organizations that do the best work at the last mile, essentially. So that's kind of, I think, that's a big moment here. Also because a lot of donors were also looking for new things that they wanted to do. Like, oh my God, we need to do more in health. Who do we trust in health? And I can name like amazing organizations in Pakistan. Child Life Foundation is one of them that rehabilitates pediatric emergency rooms in partnership in government hospitals, actually, turns them into places that look like like car workshops, into the equivalent of looking like but operating like Boston Children's. And nobody knows about them internationally, but locally they are very supported and have a high degree of trust. And there's lots of organizations like this, I think, around the world. So I think we really need to rethink how we trust, who we trust, and the amount of trust that we put into our own judgment in making that determination, and actually kind of outsource and decentralize that to other indicators which are locally grounded. So that would be one of my kind of big takeaways.
Yeah, no, I think that's very powerful. And I think we're all facing similar things, it's same donors, same place, same time. Rehema, we have 1 minute left. If we can hear from you, what are the big takeaways and that you want people to remember?
Well, I think Alicia and Nadia have really summed up the points I wanted to make on philanthropy and equity for our response. But I wanted to just emphasize, building on her, as reflecting on the trends I see with donors and the interest they have, and it got me thinking about the shadow Ugandans call it the shadow crisis that's come as a result of the pandemic. So we've had, after the outbreak of the pandemic, we've had heightened levels of domestic violence. We've had issues like unemployment hitting the stats way up there. People have lost jobs. All these other crises that have been social issues that have been magnified as a result of the pandemic it's felt like they're starting to not be the trends in funding have shifted more towards health. But I think my point is we should be emphasizing these other shadow crises that are happening along the crisis. And if we are thinking about funding or supporting people who are doing work on the ground, we should be thinking about these other social issues as well as the pandemic. The other point that a key lesson I've taken away from the pandemic has been, the saying that never waste a crisis. You have to make use of it, and we've seen many young people become innovative, resourceful, and they've really been creative in how they've responded and been part of the solution. And so my call to all leaders in all sectors is really thinking about ways to strategically partner with youth to be able to actually make them part of the solution in their communities, because they have the ideas, they are creative, they are resourceful, and they have everything it takes to create change in their communities. So I guess that's all for me for now.
Amazing. Thank you, everyone. And I know we're 2 minutes over, and so I didn't want to take any more time, but thank you so much to Nadia and Lisha and Rehema, and to everyone for the questions. I think this was a really great talk, and we'll see you on the other side of the pandemic, hopefully better and stronger and more agile and accountable organizations than ever. Thanks all. Have a great day.